Remember to subscribe, and hit the bell icon, to never miss an update from Dr. Mike Baby Care Channel.
Your pregnancy. Week 40. Congratulations, you've reached your due date. If you haven't gone into labor yet, don't worry. Very few babies arrive on their due dates, and around half of all pregnancies go past 40 weeks. Even at 41 to 42 weeks of pregnancy, your baby is still likely to be going very well, although you might be feeling tired and uncomfortable. Pay close attention to fetal movement. If you notice a decrease in the way baby moves, call your healthcare provider immediately. Your baby's development at 40 weeks. At 39 weeks, your baby is about the size of a pumpkin. Your baby's head has likely dropped lower into your pelvis, and his body is curled up tightly. He doesn't have much choice, it's pretty crowded in there. Be sure that you and your partner talk to your little bundle a lot after baby makes her grand entrance. She'll likely recognize the sound of your voices. This week, your baby is right on target at 40 weeks, which is considered full term. Babies born at full term encounter fewer risks and generally have better health outcomes. Your newborn might not look how you expect. Those perfect, plump babies in magazines are usually a few weeks old. Right after birth, newborns are wet and often show the signs of the birth they just experienced. 40 weeks pregnant symptoms. During these last weeks of pregnancy, the same symptoms you've been having will likely continue. Your main job is to hang in there as you keep experiencing these. Leg cramps. Stick with the calf and hamstring stretches to keep leg cramps from messing with your sleep. Pelvic pressure. Baby may drop even lower in your pelvis, making your pelvic discomfort worse. Trouble sleeping. If you can't sleep, it's okay to get up and do something else, but keep to a calming activity such as reading or writing in a journal. Contractions. Those Braxton Hicks contractions may eventually turn into the real deal, so if it seems like you're having a lot of them, start timing them to see how far apart they are. If they get closer together and start to feel painful, you're in an early stage of labor. Snoring. Most moms-to-be experience some changes in their breathing during pregnancy, and you might be snoring more than usual as you approach your due date. This could be because hormonal changes can cause your nasal passages to dry out. If snoring is a problem for you or your partner, try using a humidifier in your bedroom or sleeping with nasal strips across your nose. Inducing labor at 40 weeks pregnant. At 40 weeks pregnant, you may be getting antsy. After all, this is supposed to be your last week of pregnancy. You may be curious how to induce labor using natural methods. If your provider is not trying to keep you from going into labor for any reason, you can try taking walks, stimulating your nipples, having sex. If you want to try acupuncture, that's considered safe too. Now that you've reached your due date, your doctor might talk to you about inducing labor medically. Whether or not this is necessary will have to do with how baby is doing in there. The doctor might schedule this now if you have complications or are 40 weeks pregnant with twins. If baby is perfectly healthy and you have no complications, you might not need an induction at all and can keep sticking it out, even if it takes a couple more weeks. Don't be surprised if your baby doesn't arrive exactly on his due date. In fact, your pregnancy won't be considered to be post-term until you hit 42 weeks. Keep in mind that your due date is just an estimate. If you give birth a bit later than expected, it could be because your baby just wants a little extra time in your comfy belly. 8 great tips for your labor. These tips could help you feel in control and manage your pain. If your contractions start at night, then try and sleep your way through as much as possible. The rest will help to prepare you for the birth, and your cervix will dilate while you sleep. If your contractions start in the day, then keep upright and active, as this helps the baby to move down and your cervix to open up. This could speed up your labor and reduce the need for pain-killing drugs. Try different positions. Rock on a birth ball or put your arms around your partner's neck and lean on them. Just keep moving. Have a warm bath or shower. It's a tried and tested method of pain relief that's thought to date back thousands of years to the ancient Egyptian times. Paintings appear to show women giving birth in water and steam being used to help the delivery. Focus on breathing. You can practice your breathing techniques now. Take deep breaths in through your nose and out through your mouth. Keep your jaw relaxed. Ask your partner for a massage and involve them in your labor. Having their support and reassurance will encourage your body to produce more endorphins, which are brilliant natural painkillers. Eat something healthy to keep up your energy levels, like a banana or low-fat yogurt. Avoid fatty foods, as they could make you feel sick, and steer clear of sugary foods as they'll only give you a quick hit before a slump. Keep calm and carry on. If you feel relaxed, you will be able to manage your labor and pain much better than if you're stressed and all over the place. Remember why you're going through all this. Pregnancy checklist at 40 weeks pregnant. If possible, organize some help around the house for the first few days and weeks after your baby is born. Continue doing your Kegel exercises daily, they're helpful for birth and your recovery. Don't panic if you go past your due date. Talk to your doctor about induction options. Review how to time contractions. As you near the end of your pregnancy journey, it can be tempting for all the focus to be on getting to the finish line, but if you can, take some time to reflect. Whether you basked in your pregnancy glow or struggled through challenges, try to appreciate these final moments with your baby before they are born. Most importantly, be sure to give yourself the credit you deserve for all the hard work your body has done growing and nourishing your baby to be, and embrace that strength as you transition to new parenthood. Thank you for watching. Don't forget to subscribe.